Quick word before I start. This is nothing to do with Tufts Health Plan tonight. If you come here looking for a sales meeting, sorry, it's not going to happen. It's all about getting Medicare. I'll touch on premiums, but this is all about getting Medicare. This is not about talking about how wonderful Tufts is or anything like that. You can call me and ask for information, go to my meetings, which are up at the Radisson, fine, but don't be too disappointed tonight. Did that get us to 7:30? No, it didn't. All right, we're starting half a second early. I'm Gerald Lodge. I'm from Tufts Health Plan. If I can, so we have some form of order tonight, can I ask that you hold your questions until I get to the end of each slide? And you'll know when I get to the end of each slide because I will go, any questions? All right, okay. Now, show of hands. Who here has Medicare A and B? Who here has just Part A? Who here has neither part? Who hasn't put their hand up yet? Great, everyone's, all right, so we're all good. So everyone got to put their hand up. Right, so I'm gonna wear my neck out looking at this. So what we're gonna do tonight, we're gonna give you a sort of a guide into how to get Medicare, when to get it, give you like a timeline so you know what to do, when to do it. We'll actually let you know what you're getting when you get this Medicare. What is it all about, this Medicare A and B? I'll go over the options that you have effectively in the marketplace. Again, I'm just going to be generic. I'll give you some figures so you know what you're looking at. Priuses or Ferraris. So you'll find it very entertaining. Now, trust me, I've seen the presentation before. So you've got to think of your own situation. So if you're coming up to 65, and at 65 you're going to say, right, I'm retiring, or at 65 I'm going to have no insurance. If that be one of you or 10 of you, this slide is relevant. So if we're coming up to 65, we're retiring and we need Medicare. And when I talk about Medicare, for the purposes of tonight, I'm referring to Medicare A and B, what they call original Medicare. So Medicare A and B. So in this instance, Medicare A and B is effective the first day of the month of your 65th birthday. So if your birthday's the 23rd of July, 1st of July. Unless your birthday is the first of the month, then it's the first of the preceding month. So just bear that in mind. Now, so you've all got that in your mind now. So now with that in your mind, you have a 7-month window around your 65th birthday in which to start the quest for Medicare. So you can start the quest up to 3 months before your birthday. So let's have a look. So if your birthday is 23rd of July, right? July the 1st is when the Medicare is starting. 3 months before, I haven't rehearsed this, so I might get it wrong. April, May, June. Those are your 3 months beforehand. So any time starting April the 1st, you can apply for the Medicare. You can also apply for it the month of your birthday, and then another 3 months after. So if you're taking original Medicare A and B at 65, you've got a 7-month window around your birthday. Right-hand side is going to let you know how to do it. If you are collecting Social Security, which we know, for whatever reason, we can start taking at 62, if we need to. So if you're already collecting Social Security, you're going to be quite pleasantly surprised to receive that Medicare card, A and B, in the mail up to 3 months before it's scheduled to start. There it is, A and B, brilliant, It's in the form of an offer, if you don't send it back, keep it, you'll get billed 12 equal payments. If, on the other hand, you say, well, I'm not collecting Social Security, you now have to have a conversation with Social Security. So if you're coming up to 65 and you're saying, okay, I need this Medicare A and B, but I'm delaying Social Security for 66 or later. So Social Security is sitting there going, I wonder what they're going to do. I wonder if they'll tell us. And you have to, you can certainly go in to your local Social Security office. Good luck to you. The better way, at the comfort of your own home, anytime, day or night, you can do one of two things on the computer. One, socialsecurity.gov. Make sure you put GOV at the end. Or you can do medicare.gov. And then what you're doing, let's say you do socialsecurity.gov. Homepage comes up, top right-hand side. It'll say sign in, sign up. If it's your first time, go in and you sign up. You set up an account. Okay, and this is also a good way so you can go in and see what you're going to get from Social Security, retirement or whatever. So you can do this at any time. Now, you go in, you sign up, set up an account. Now what you're going to do is you're going to tell Social Security, this is me, I don't want Social Security. I do want Medicare A and B, whatever the case may be. And you let them know. And again, you can do this up to 3 months before your birthday. And generally, 30 odd days later, you'll receive this paper. It's still paper, this Medicare card. You'll receive a paper Medicare card with A and B on it. Okay. And let's understand the relationship between Social Security and Medicare, because we get a bit confused here. So Medicare is a form of paying for your medical bills. Social Security is a form of payment to you. The connection is that I get Medicare through Social Security, in person or online. The other connection is any payment that I'm going to make for the Medicare is going to be collected by Social Security. But then you quickly go, yeah, but I'm not going to be taking Social Security yet. So if you take Medicare at 65 and you say, well, I'm taking Medicare, but I'm delaying Social Security for 66 or later, what Social Security will do is they'll send you a bill in the mail for 3 months worth of premium. And I'll tell you what the premiums are in a minute. They'll send you a bill in the mail for 3 months worth of premium until you do take Social Security. So you get a bill in the mail until you do take Social Security. Okay. Questions on this slide? Yes, please.
I mean, I think I know, but I have a pension. So I don't go through Social Security out of my paycheck all those years. I had Medicare deducted. But I won't be collecting Social Security. So it doesn't come in the mail or anything. I just have to initiate the whole thing, right?
You have to go, yes, you have to go in and tell them. You know, it's kind of, so to speak, they're waiting. Okay. And it's waiting until you go, I want it, give it to me.
So if I had Social Security, I'd be getting a prompt.
No prompt. Well, I mean, again, you can take Social Security at 62 for whatever reason you see fit. Full Social Security is 66. It doesn't mean at 66 they're automatically sending the Social Security to you. You've still got to let them know.
No, I didn't know that.
Yeah. Yes.
So I'm not eligible for Social Security. I'm a Massachusetts teacher.
Mm-hmm.
I have the Mass teacher's pension. So how does the billing thing work for me? Why can I always bill for Medicare?
What I would suggest you do is you go back to your benefits department for the school or for the town itself and ask them how they do it. Because there's different rules and regulations. But go back to the school and ask, because then they're going to come along with plans for retirees. They're not just going to sort of say, thanks for working for us, now you're retiring. They're going to have plans for retirees as well, which are going to be a little bit different from what I'm going to be talking about tonight. So I don't mean to evade the answer, but go back to the school, follow their directions. Okay. There was a question here? No?
No, I have a comment though, that even if you're in a pension as a teacher, right, if you've worked outside and you have enough quarters, I don't have enough quarters, because you could still be eligible for some Social Security, but with the rules, especially in Massachusetts, you can't, what they call double dip, but there's a percentage that we can receive Social Security.
And also you can potentially apply through a spouse for theirs as well. But again, I don't want to deep dive because I'm going to get very iffy on social instance. All right, any other questions? So again, this is going to apply to some of you. Some of you are going, get to the next slide. It's going to get exciting. So turning 65, I need Medicare A and B. This is the slide. But I'm working past the age of 65. Then this is the slide that's relevant. Now, before I go through this slide, what generally happens when we say, I'm going to work past the age of 65, and you find that your company is still going to give you the same insurance that you have right now. I'm working, I'm turning 65, they're going to give me my same insurance, everything's going to stay the same. The correct thing to do is to, again, socialsecurity.gov, go on, sign in, let Social Security know. I don't need social, don't need Medicare because I'm still working. And so Social Security says, thanks very much. We'll send you a Medicare card anyway, but they send you the Part A. Who's got the Part A card? All right, so generally we're past the age of 65. We're still working or covered by a spouse who's working. We don't use the Medicare. We don't show it to anyone. We don't even know why we got it, really. So the correct thing, if I'm working past the age of 65, the correct thing is to let Social Security know what I'm doing. Don't need social yet, or you do, whatever. Don't need Medicare, still working, thanks very much. They send you out a Part A card, and at the same time they say, well look, don't show this to anyone, don't use it, carry on with your commercial insurance as if it never existed. And you sort of say, well, why would I go and get Part A then? What's the point of getting Part A? It's so that when you do retire, and I'll talk more about that on this slide, it's so that when you do retire and you apply for Part B, life's a lot easier because now you're already in the system. Your visit with Social Security is going to go that much quicker because you're already in the system. But anyway, so if someone then sort of says, well, actually, I'm 67 and I'm still working, I forgot to have a word with Social Security. I didn't tell them anything. And I don't have A and B. That's fine. As long as you've got group insurance, company insurance is as good as, if not better than Medicare. All it means is your visit to Social Security is going to be that much longer because you're not in the system. So if we do go by 65 and we do not have, we've had no conversation with Social Security. I don't need social, Medicare. It just means that your conversation with Social Security is going to be that much longer. All right, now, so we're past the age of 65, we're working. We got Part A, got company insurance, and now we're going to retire. This is the slide that's going to take you through that. So again, if we have Part A, now we're going to apply for Part B. Part B, again, is the first of the month. So if you retire on June the 15th, make sure your company is covering you until the end of the month, because Medicare is effective the first of the month. So you're either going to have an overlap, or you're going to go for a little while with pretty much no insurance. Again, You could start the quest up to 3 months beforehand. If you came in here and you said, I think I'm going to retire April the 1st. What are we on, the 12th of March? You can still do it. You can still do it. It's just that everything's got to happen that much quicker. If you've got 3 months, use it. You've heard of COBRA, where you can continue with your regular insurance but pay 100% or maybe 102% of the premium. If you are eligible for Part B, do not take COBRA for more than 8 months. There'll be big problems if you do. Worried look on face. Don't do it. All right, so we're going to apply for Part B. Now we hear things like, well, if I don't take Part B when I turn 65, there's a penalty and they're not going to let me take it when I want it and things like this. Go to the right-hand side. Social Security is going to say, well, if you were working past the age of 65 and you had company insurance, we're going to need you to provide us with some proof. And before anyone thinks, oh yeah, I'll get that thing in the mail from my insurance company at the end of the year. No, not that, not that. There's 2 forms that you can print out. Here we have life-size replicas, all right? 2 forms. You can go home to your computer, put in whatever Google search or whatever it is you have, and you can print these out yourself. There's 1 page of form, and there's about 2 or 3 pages of instructions and why are you doing this. So the first one, CMS, Center for Medicare Services, CMS-L564. This form here. I will pass this around when my arm starts aching. This form here is the one that you fill part of it out and your company fills out the other part, testifying the fact that you've had continuous coverage and it's stopping as of such and such a date. This is the form that lets Social Security know you had other insurance, therefore you're not going to be subject to a penalty, and it's going to let them know when you need the Medicare Part B to start. If you'd like to have a quick look and pass around. Now, again, you can print this out on your own printer. Print it out here if you like, I suppose. Now, the other form, CMS-40B. There it is. It's half a page. More pages of instructions. This is the form to apply for Part B. Name, address, date of birth, that sort of fun stuff. So ultimately, you print those forms out up to 3 months before you need them. Now, if your company is big enough, the CMS L564, your company will generally be able to print one of those out and have it filled out for you. You get those forms filled out up to 3 months before you need it. If it's 3 weeks, it is what it is. Now you cannot apply online. You print them online, brilliant. But now you have to go in person to your local Social Security office. Fully charged phone, large cup of coffee, you go in. Now, if you've got 3 months, it doesn't hurt to phone them up and make an appointment. If, they say, well, we can't see until 6 weeks or something like that, just go, stand in line, take a number, go. You take these forms with you. And what you're doing there is you're applying for Part B. From the purposes of an insurance plan, because, again, Social Security say, oh, you'll have your new Medicare card in 30 to 40 days, something like that. From the purposes of an insurance plan, as long as you are showing up in the Medicare system, whether you've got a card or any other proof or not, doesn't matter. As long as you're showing up in the Medicare system, you are free to enroll in the health plan of your dreams. So the point is this. If you go to Social Security and they say, oh, that envelope that you have with you, you can just put it in that pile over there. Don't do that. I have questions. I need to speak to someone on the other side of that counter there. Speak to someone. Give it to them. Sometimes, if the office is slow enough, they'll actually enter the information in and it will show up a day or two's time. Other times, if it's a very busy office, they're going to just go over it, make sure it's all been filled out, put it in a pile over there, and get to it when they do. But don't be tempted to just drop it off and escape. Go the whole way. Go the whole way. Give it to them. Make sure it's been filled out. And again, if it's slow enough, they may even enter it in front of you. Questions on this slide? All right. So turning 65 and retiring, this slide, working past the age of 65 and retiring. This is just that little bit on COBRA. You get this 2 or 3 times a year, if that. And unfortunately, what happens is we all go out and marry spouses that have a different date of birth. And so sometimes when we retire, and we have a younger spouse, and we sort of say, well, I will cover you until you reach 65. Thank you very much. And so what happens is, you might not take Part B. You might say, we'll take COBRA, and I'll delay the B, and you'll turn 65 and everything will be fine. If you are eligible for Part B, i.e. you've retired, if you are eligible for Part B, and you go on COBRA so that your younger spouse can get to 65 and go and get Medicare, do not, got everyone's attention, do not take Medicare for more than 8 months, or this slide is going to be a very unpleasant slide. So what happens is, if you take COBRA for more than 8 months when you are eligible for Medicare, this is going to happen. When you do go and to your Social Security office and say, I'm here to apply for Part B, they're going to go, well, can you come back between January the 1st and March the 31st? And by the way, your Medicare Part B is going to start July the 1st, and we're going to give you a penalty. There was a chap who did basically what I told you about up on the North Shore. He covered his wife, deferred Part B, covered his wife. She turned 65, got Medicare and got a plan. He then, in October, went in to Social Security to apply for Part B. They said, well, you're a bit more than 8 months. This was October. They said, can you come back between January and March? The B's going to start July the 1st, and we're going to give you a penalty. He thought he was doing the right thing. And so, if you take nothing else from here, I'll be disappointed. But if you don't take COBRA for more than 8 months if you're eligible for Medicare. All right, any questions on that? All right, if we're not worn out enough already, this is what we did all of that work for. Medicare A and B. And if we say, do I really need this? At the end of the day, no matter what you do, no matter what health plan you're really going to take, you're going to want to have Medicare A and B. If you're eligible for it, you're eventually, when you retire, going to want to take it. It's not really optional, and it's something you're going to want. So there's 2 parts to Medicare. Part A and Part B. I'll give you a brief overview, and then on the next slide, we'll have a look at what the other options are when you have Medicare. So Part A is free for most people. Part A covers you for skilled nursing, inpatient hospital stays, amongst a couple of other things. Now, if you're admitted to a hospital, inpatient, I'm staying in there, they're feeding me 3 meals a day and all that sort of thing. If you're admitted to the hospital as an inpatient, that's where Part A comes in. And you have a Part A deductible that you are responsible for of $1,364. That is not per day. It is not per stay. It's what Medicare calls per benefit period. So Medicare says this benefit period starts the first day you're in the hospital. Doesn't matter if you're in there 1 night, 20 nights. Hospital ultimately is going to send you a bill for that amount. The benefit period resets the 60th consecutive day you've been out of the hospital. So whether you're out of the hospital for 61 days, 123 days, whatever, you go back in again, ka-ching, $1,364. That's the hospital, the bricks and mortar. Part B, the optional one, that has a premium for most people. This year, most people are going to pay $135.50 a month. Again, if you collect Social Security, it's automatically taken out of your Social Security check. If you're taking Medicare but delaying Social Security will send you a bill in the mail for 3 months at a time until you do take Social. Now, most people pay $135.50. It's income rated, and I don't have the figures because it's like married filing like this, married filing individually, individual, So there's different things. If you go onto socialsecurity.gov or medicare.gov and do a search for the income related Part B premium, there'll be a wonderful chart. Figure out how you do your taxes, and Medicare does a 2-year look back. Point is, if your income is sufficiently high, you can pay over $400 for exactly the same Part B. If your income is low enough, Part B can be paid for you. It doesn't, just in case anyone misunderstands, it doesn't jump from 135 to 460. It goes up incrementally, depending on your income, all right? So you're paying for Part B. Now, Part B is the one that covers you for doctors and tests and outpatient services. So Part B this year has a deductible, an annual deductible of $185. The first $185 of doctor visits or tests, whatever comes first, across Medicare Part B's front door, you're responsible for. Then we get to the Medicare pays 80% of the reasonable charge, you pay the 20%. Because we coat Medicare with this 80%, 20%. Well, that's Part B. That's not Part A. That's Part B. So when we use Medicare, and let's understand that sometimes we get Medicare and we have this image of various services being pulled back and they're not going to cover this. When you're not well, Medicare is pretty much going to cover what you need. Don't expect services to be taken when you're not well. It'll be some of your routine services that you may have right now that you're not going to have anymore. But when you're not well, Medicare's pretty much going to be there, but it's going to, involve you in sharing quite a lot of the cost. So for services that Medicare covers, you are either paying the hospital deductible, the annual $185 medical deductible, or the 20%. Those are your three balances. Those are the three balances for covered Medicare services. Go to the right. You can see anyone in the country who accepts Medicare, and pretty much everyone does. You're going to walk a long mile to find someone that doesn't accept Medicare. So you can see anyone in the country who accepts Medicare. There's no networks, there's no referrals, there's no ins and outs. But there's also no maximum out of pocket. So if you're having a bad year and you're in and out of the hospital and you're seeing doctors and things like this having tests, whatever these amounts add up to, you're responsible. There is no cap, there is no limit. And you've got to be careful because, for example, if you're in the hospital, maybe you're in the hospital, 3 days and they do surgery. If the surgeon and the anesthesiologists are not part of the hospital staff, and they send in their own bills for their time and effort, that's coming in down here. So you've got to be careful. You think $1,364, that's a lot of money. Yeah, well, it can go up even more if they're independent providers that you're seeing in the hospital. So, and Medicare, by the way, Medicare sends you out every time, so you're not sort of trying to keep a ledger with all of this lot. Medicare sends you out a piece of paper every time they process a claim, no matter what they do with it. And the legend at the top is, this is not a bill. And it will let you know who you saw, what the services were, what they submitted as a bill what they have agreed to accept as payment in full, what went to the deductible, what got paid at 80%, what you might expect a bill for in a few weeks' time. All right, so Medicare does all of that for you. And again, in Massachusetts, for example, they cannot balance bill. Whatever Medicare allows is what everything is based on. Medicare doesn't cover you out of the country. So if you're thinking of traveling, it's not going with you. The only exception is if you're in America, something happens and the nearest facility is across the border in Canada or Mexico. That's the only exception. And if you want to learn about Part D, I'll tell you all about it, but not here. This is nothing to do with Medicare A and B. This Part D, prescription drugs, has nothing to do with A and B. I'll tell you about that on the next slide or two. Now, before we deep dive and get all worried, it's terrible, it's deductibles at 80%. Most people take from this, and I'll tell you this, that is very good. For $135 a month, that is very good. But most people look at it and go, yeah, but I was going to travel abroad. I need prescriptions. I need lower out-of-pocket costs. We look at that on the other slide. Don't start getting worried about this. Just know that there's options. We'll talk about them in a minute. But before I get there, any other questions on this?
Well, the premium for Part B, that income, that's determined on your income through your working years?
2 years, they go 2 year look back on your taxes.
2 years.
So you're not doing the turbo tax. They know, this is the government, they know what you earned.
2 years back, is that?
Yeah. So if someone was paying a lot more, as you get into retirement, you'll eventually see the premium come down. And what happens is if there is a cost of living increase at the end of every year, if there is, then, you know, they will give us with one hand and they'll take us back with the other. So that's when we see the 135 go up. When there's a cost of living increase, okay? All right, anyone? All right, you had your chance. So most people then say, very good, well, they don't actually say that, but I'll say it for you. Very good, but I need something else. And so we go out into the showroom. And this is where it gets very confusing for pretty much most people. Because sometimes you get brave and you go to meetings and you phone up company, send me your information, please. Or you get a lot of information sent to you in the mail and you're trying to figure out what is it all about. Before you start looking at health plans from different companies, it's always a good idea to have an idea of what you want. You know what I mean? And most, you know, and that's perfectly normal, doesn't it? Well, of course. But then you say to most people, what do you want? And they go, I don't know, you haven't told me what you got in the health plan yet. So it doesn't hurt if you sort of sketch out a bit of parameters, sort of, you know, like this. I want a particular doctor. I want to go where I like. I'm going to travel abroad. I'm into wellness. I take 10 medicines. My budget is this. Just things like that. Because if you have an idea of what you want, the options are going to make more sense. So rather you trying to figure out how you fit into all of this lot, it would be a lot easier if you figure out how they fit into what you want. On the understanding that for whatever reason you seem fit, at the end of every year, you can change. This is not a lifetime commitment. This is not a case of looking into a crystal ball. What's my health going to be like in 5 years' time? This is none of that. This is a year. And generally, most people seem to base their decisions on three things. What they actually need, well, I see 3 doctors a year, I take 2 medicines. What they're comfortable paying every month. My budget's $140. And then, where your comfort level is. The old what if. Because it's not like your company is providing you insurance anymore and you say, well, it is what it is. I can't do anything about it. And you just get on with your life. Now it's down to you. You've got to find something that you're comfortable with paying for every month. Also, having that coverage if something happens. So you've got to do a little bit of looking around. So with that said, these are the options from any company in this country. I'm not talking about Mass Health, I'm just talking about, I've got Medicare A and B, what are my options? And for those of you that may be eligible for a group retiree plan, these options still apply, but with a group plan, a group can always come along and go, no, we're going to add a rider, which will do this and that. And so a group plan, they can switch things around a bit. But this is regular, I've got Medicare, what are my options? And it doesn't matter what company or whatever. I will give you ranges of premium, so we know if we're looking at Priuses or Ferraris, so at least you have an idea. And I'll kind of guide you as to the pros and cons of going each way, and you've got to decide what that means to you. So, right across the top, if you had a will to, you could write down on your piece of paper $135.50 for that Medicare A and B, because before you do anything else, you must have A and B. You must keep A and B, and you keep it by paying for it. Okay? So $135.50 cast in stone. And don't forget that. So many people forget that they're paying for the Medicare. You're paying for it. So before you get anything else, you're paying $135.50 for the Medicare. Don't forget about that. Now, whether it be good, bad, indifferent, here are your options. First option, on the left column, you say, Medicare, 80%, brilliant. But I need Part D prescription drug coverage. Like I said earlier, you don't get Part D from Medicare. If you phoned up Medicare, can I have a Part D drug plan? Really short conversation. The way you get Part D, you see what happens is Medicare lays out the shell of the average Part D drug plan in this country. There is an average premium of this. There is a deductible. There are percentages and co-pays and a formulary, and there is the gap. And Medicare says, tell you what, private companies, you offer your version of that, and we'll pay you every month for everyone you enroll. So all these little private companies, some you've heard of, some you haven't, they all come along, we'll have this premium, we'll have this deductible, we'll have these co-pays, whatever. And Medicare pays them for everyone they enroll. So you get Part D from private companies who are funded by Medicare. Some of you have seen this book. Curiosity, anyone actually read it? You cover to cover, like that. It's really quick. Do it like that. Just hold it there. Cover to cover, really quick. Now, when you get Medicare A and B, you get this book. When you get Medicare A and B, and you also are sent an updated version end of September, early October every year. You turn this book sideways, thus, and you go to the back of the book, and it shows you all 26 standalone Part D drug plans available for you to choose from in Massachusetts. There ain't nothing like having a choice. Premiums. If you had a mind to write something here, the premiums go from $14 to $127 a month. That's a lot of plans with a very big variance in premiums. 8 minutes on your computer at home will sort that lot out. Go to Medicare.gov, that official Medicare website. When you go to Medicare.gov, on the home page, on the left, there's 3 green buttons. The one on the left says, Find medical and drug plans. Click on it. Give them your zip code. This is Medicare, remember, this is Medicare. You give them your zip code. And then it's going to say, well, do you have Medicare? Just pretend. Yes, I do. Do you get any assistance? If you get assistance, low income or whatever. And then it says, do you want to enter your drugs now? You go, yes, I do. And then you go to the next screen. And you put in your medications, and Medicare's going to say, okay, maybe there's a generic version of this, what's the quantity, what's the strength, and you're putting in your prescriptions. When you finish doing that, and again, you can go back, well, what happens if this happens? You know, you can go back in and, you know, I'm coming off of this medicine, I might go on that one. You can change the Medicare, the prescription list. So when you put in the medications, next screen it says, okay, what pharmacy do you go to? Now, this is Medicare, so I don't care what, you know, everyone's, you know, and it will give you within 1 mile radius, 1.5, 3 miles, figure out what pharmacy you go to. And again, you can change that. You can, because sometimes the results of the plans are different depending on the pharmacy that you go to, as the prices of the medicines are different. After you put in the pharmacy, go to results. The top result, just remember, the top result is Medicare and Part D prescription drug plans. And what it'll do, when you go to the results, Medicare will have done all the calculations for you. And the first plan that comes up, the first drug plan that comes up, it's not saying it's the best, not saying it's got the most wonderful customer service. What it's saying is, based on the medications that you gave it and the pharmacy that you go to, it is the most cost-effective plan for the rest of the year. Premiums, deductibles, co-pays, it's the most cost-effective plan. It may be cheaper than the next one by $20 or $200, but it's the most cost-effective. So you're not, you know, sort of sticking a dart in there going, oh, I'll take that one, see how it goes. That's 8 minutes of your life. And if you can't remember it, you can call me or email me afterwards. All right, if you don't take medicines, no one says you have to have a Part D drug plan. But yes, if you don't take a Part D drug plan when it's initially offered to you, Medicare is going to assess you a penalty when you eventually take it. Medicare is, one, going to limit the time of year you can take it, end of year, assess you a penalty, which the poor drug plan is going to be collecting in the form of a higher premium, and you have that penalty for the rest of your life. It's not that great, but you have the penalty. So that's the first option in the showroom from anyone. I've got original Medicare in all its glory. I've gone out and purchased one of those 26 drug plans. Next option from anyone. If you say, well, you just talked about all these deductibles from Medicare and you just talked about this 20%, what can we do about that? Next option, in the middle there, is a supplement, often referred to as a Medi-Gap plan. Think of the name. It's supplementing Medicare. It's picking up the gaps in Medicare. So now, when we go to a doctor or a hospital, we're presenting both cards, the Medicare and the supplement. The provider is sending the claim, the bill, to Medicare. Medicare's going deductible, 80%, whatever. Medicare, not you, not the provider, Medicare is forwarding the balance to the supplement. And ultimately we're looking at the supplement to pay the balances, the deductibles, that hospital deductible, the medical deductible, and the 20%. Supplements pay balances for covered Medicare services. Supplements pay balances. So before we start, you know, sort of interrogating supplement, well, are you going to cover this? Can I see this doctor? You ask the question of Medicare, supplements pay balances for covered Medicare services. I can see. So therefore, you know, we have Medicare in front, so therefore we can see anyone in the country who accepts Medicare, supplements pay balances. No networks, no referrals, supplements pay balances. It doesn't matter where you go, the provider don't care whose supplement you got because Medicare is forwarding the balance to the supplement. All right, now, supplements pay balances for covered Medicare services. Generally, if Medicare doesn't cover something, the supplement's going to go, oh, neither will we. Medicare A and B at the top doesn't cover Part D prescriptions. That's one of those 26 ones in here, yeah? Therefore, and I can say this hand on heart, no supplement covers Part D drugs. It's always separate. So, I've got Medicare paying first. Supplement pays balances. I've gone and got or purchased a Part D prescription drug plan if I need. Okay, you can get any one of those 26 in there. Now, this way of going about things is relevant. If your specification, remember the specification, says, I want to be able to see anyone. I want Mass General, I want Brigham's, I want Beth Israel, I want Leahy, I want anyone and everyone just in case. I don't want a network, I don't want referrals, I don't want ins and outs, and I detest co-payments. And if you're saying that, then go wherever you like, as long as they accept Medicare, which pretty much everyone does. Supplement's just going to sit there and pay the balances, and you go out and get a separate drug plan. So the flexibility is there, no co-pays, go where you like, no networks. Downside is the supplements are always the more expensive way of going, and they don't include drug coverage. It's always separate. And again, you're generally paying the balances. Now, any company in Massachusetts that offers supplements, offers 2 standardized supplements. In other states, you're lucky you're in Massachusetts, I tell you. In other states, there are going to be, there they are, 11 other types of supplements. It really does get confusing. In Massachusetts, any company that offers a supplement offers 2 standardized supplements, really easy. The more affordable supplement only pays the 20%. The more expensive supplement says, yes, it's paying the deductibles, yes, it's paying the 20%. So the more affordable supplement, it's essentially paying the generally just the 20%. It's not paying the deductibles. So again, if you go back to your specification, I'm seeing some doctors and specialists, having some tests. I will never go to a hospital. Supplement, the more affordable supplement, which is generally for most companies called Supplement Core, C-O-R-E, would be perfectly fine. The more expensive supplement, the general term for that is called Supplement 1. Says any service that Medicare covers, it's paying the balance. You have no copay, you have no deductible, you pay your monthly premium on time, you have 100% coverage. Okay? Now, just to give you a line in the sand from Tufts, there's discounts, but I ain't going into that lot. The Supplement Core, the more affordable one, is $114 a month. The more expensive one from Tufts is $212 a month, just so you have an idea. So I've got Medicare at $135, $114 or $212, and a drug plan, $14 to $127. If I want to go where I like, there you go. The other option from any company, far right hand side, is known as a Medicare Advantage plan. If you're doing the letters of the alphabet, it's also known as Part C. Still got Medicare, still paying for it, but now the relationship with Medicare is very different. And I'm going to tell you this, and of course you're not going to do it, but forget about the 20%, forget about the deductibles. What happens now is Medicare figures out what it expects to pay out in claims for people that live in a given zip code, given area. And then Medicare averages that out over the year. And Medicare says, tell you what, Medicare Advantage plan, we'll pay you every month a percentage of what we would have expected to pay out for that person, and you, Medicare Advantage plan, take over everything. Everything. So therefore, I have Medicare, I'm still paying for it. Now it stays at home. All it's doing is paying the Advantage plan to take over. So if you want to kind of draw a parallel, it's like when you're working, your company pays most of your premium, Now your company's called Medicare. They're paying most of your premium. So in this instance, we go to the Medicare Advantage plan. And that's where our interest lies. What's my premium? What's my co-payment? How does it work? That's where you turn your interest. Okay? Now, a couple of things with the Medicare Advantage plan. Medicare Advantage plan is going to be somewhat similar to what you have right now. Because Medicare says, look, if you take this Advantage plan, they'll pay them every month. But if you want prescription drug coverage, Part D, you can't go out and get one of these standalone ones. Medicare says, no, we're only going to pay one plan at a time. So Medicare says now, if you go out and get an Advantage plan and you want Part D prescriptions, you've got to find an Advantage plan that includes Part D prescriptions. So you put your medical and your drugs, Part D, together, one card, like you have right now. Also, any Advantage plan is going to have a form of a network. HMO, PPO, private fee for service, point of service, whatever it is. So the point is, you've got to go back to your primary care doctor's office. Don't make any assumptions. I'm seeing you now under this plan, therefore, don't make any assumptions. You go back to your primary care doctor's office. And you say, what Advantage plans do you accept? We accept this one, and this one. Fine. And you concentrate on those plans. It's terrible when you sort of go down and you learn all about a company and a plan and whatever, and you I love that plan. And then at the end you go, oh, they don't have my doctor. It's a good idea. Get that out the way first. Get that out the way first. So, again, like you have right now, you've got a network, you might have referrals, ins and outs, preferred and non-preferreds and all this sort of thing. With an Advantage plan, you're going to have co-payments, like you do right now. And with an Advantage plan, you're going to have generally more of your wellness benefits like you do right now. Physicals, eye exams, maybe a bit of dental and all that sort of thing. Now, we hear about these plans that have no premiums. And that's generally what we talk about with these Advantage plans. What happens is any company that offers an Advantage plan is going to offer different levels of that plan. And the different levels are going to be exactly the same except for generally two things: the premium versus the co-payment. So the idea is the higher my premium with the plan, the lower my co-payment. The less I pay the plan every month in premium, the higher the co-payment. And so every now and then you see, we even get the mailing through the front door, you see these plans that have no premium. Again, I'm not talking mass health, put that aside. I'm talking about regular Medicare Advantage plans that have no premium. Get all of this for zero premium. Sometimes we go, oh, it's too good to be true, blah, blah, blah. The money Medicare is paying those Advantage plans is plenty enough so that the way they design the plans based on the co-payments on the lower level, the money they get from Medicare allied to the person's cost sharing, they can offer, most companies can offer plans starting with a zero premium. You have to decide whether that's right for you. Again, think of you're working at a company right now. Your company pays most of your premium. If your company paid all of your premium, would it be a bad plan? No, it just means your company's paying all your premium. So just remember, Medicare is essentially paying the premium. So we have co-payments on the Advantage plans. They're not paying the 20%. They're not paying the deductibles because it doesn't exist. I go to the doctor, here's my Medicare Advantage plan, here's my co-payment, thank you. That's it. You're not getting anything from Medicare, just like you do right now. So all right, so Middlesex County with Tufts, with our Advantage plans, our most affordable is zero, no premium. What's the bill every month? Nothing. How much do I? Nothing. The most expensive, lowest premium, lowest co-payments is $199 a month. So now you have a range of premiums for pretty much everything. Obviously that's very high end, but you have a range of premiums. Before I go into the wonderful world of Part D and explain all about the donut hole to you, if you're smiling now, you won't be in a minute, don't worry. Any questions on this? Sir?
Let's assume you retire and you're doing supplement plan for 2 years. Then all of a sudden you think maybe your health is starting to deteriorate, you want to go to Medicare Advantage plan. Will they exclude certain types of payments?
It's a good question. If you can't get to sleep one night and you open this up and start reading it, you'll see in certain states they can sort of say if you leave a plan you can't go back and all that sort of thing. In Massachusetts, at the end of every year, for whatever reason you see fit, you can make a change, and I'll tell you a bit more about that in a minute. You can make a change for whatever reason you see fit. And if we sort of say, well, what would stop us taking one of these plans in the first place? There's one medical exclusion that would be on anyone's application. And that is ESRD, end stage renal disease. And we go, huh? Medicare, for whatever reason, said we will have a special program for people with end stage renal that are on dialysis, etc., etc. And so Medicare says if you have end stage renal, you cannot join a Medicare Advantage plan because we, Medicare, have a special program. That's the only diagnosis. And so if at some point, X amount of years down the road, you want to go from one to the other, and you make that change at the end of the year, that's the only question. Doesn't matter what's been going on, it's not a case of what medicines are you taking. In Massachusetts, these premiums are not age rated. It's the same for everyone, and you can make a change every year for whatever reason you see fit. Other questions on this slide? Yes, sir.
So the Advantage plans, if you look at them, they have that annual limit, $4,000, $6,000. What does that all cost?
Okay, so we hear maximum out of pocket, and we see limits like 3,400, 6,900, and we go, ugh. And you find that generally you'll have this on your plans right now. So what that is, it's a good thing. It's a good thing. If you fall out of a plane just before you hit the ground, a parachute's going to open up and give you a gentle landing. So what it does, it says, if you're on some of the more affordable plans that might have higher co-payments, if everything goes wrong and now you're in and out of the hospital and you're taking ambulances everywhere and there's day surgery and hospital stays, depending on the plans that you're on, your co-payments can start to add up to some serious money. So if during the course of the calendar year, if your co-payments reach whatever the plan has as the maximum out of pocket, then for the rest of the year, any service that they cover, they're going to cover 100%. So with Medicare, there is no limit. Whatever the deductibles and the 20% add up to, there's no limit. But with the plans, and this is one of the things that, if you're cautious, you're going to go, well, I'm going to take a plan with a lower limit just in case. It's not something to reach. I'm going to get really sick and get to the 100% coverage. It's there to protect you just in case. It's the parachute that opens up just before you make a mess.
So he's already met his limit for the year. So now when we go to a new plan in a couple of months,
It doesn't carry over.
it doesn't carry
No,
over.
because this is plan specific. It's not a Medicare thing, it's a plan thing. So you can't sort of, no, I've met $3,000 here, I'll take that. No.
Out on that one.
Yeah, so we're just going to plan with low co-payments. So you're not going anywhere. I mean, all the plans have these maximum all of the Advantage plans have these maximum out of pockets, but when you look at some of the plans, the co-payments are so low that it's more like a symbolic thing. There is no maximum out of pocket with a supplement because it's paying balances for covered Medicare services. Other questions on this slide, please? Again, just go home, stand in front of the mirror. What do I want? Well, I don't know. Write it down, have an idea. You know, it's like you don't go into the car showroom and say, right, tell me about all this lot in here. And then when you've done that, we're going to go outside and tell me. When you go to the showroom, you know, I want that one. I want it in red. And I don't want to pay more than $200 a month, whatever. You know that. But most people don't necessarily know what they want before you end up with all of this information. All right, so that's your showroom. Doesn't matter where you are, doesn't matter what state, what your friend has, that's your showroom. And again, if you're a group retiree, they can come along and they can change things around a bit, but understand that the playing field is basically the same. So on that exciting note, this is this Part D prescription drug coverage. So Medicare says, you know, you get Part D from private companies. We can all change premiums, deductibles, co-pays, formularies, and whatever. Excuse me. The one thing Medicare says that everyone must have is the gap, the donut hole. And I tell you about it and you go, And the point is, most people go nowhere near it. But it's just on every single Part D plan in the country, it's the great equalizer. Most people go nowhere near it. And if remember, the Medicare.gov, when you're looking for those 26 drug plans, when you go to the results, and it will tell you the name of the plan, and it will tell you this is how much it's going to cost you for the rest of the year at the pharmacy. This is how much it's going to cost you for the rest of the year through the mail. But if you click on the name of the plan and go into the results, it gives you some good stuff. It will tell you how much the prescriptions cost at that pharmacy, what the negotiated price the plan has with the pharmacy, and then it goes down and it gives you a bar graph for every month for the rest of the year. And there's various colours. So the grey bit at the bottom is your monthly premium. Whatever it is, it's your monthly premium, that's a constant. Then it'll say orange is a deductible, because some plans may have a deductible. Then it'll say green is co-payments. And then there's, I don't know what the other colour is. And it'll let you know if you go into this gap. And so when you click on it, you can say, oh, I'm going into the gap in November. You know, it'll let you know. And if you're going to go nowhere near it, it'll let you know. But the point is, it's going to let you know exactly what you're paying every single month. Premiums, deductibles, co-pays, it's going to let you know what you're paying every single month. So this is how it goes for any plan. Doesn't matter if you get it Part D by itself or it's part of an Advantage, this is it. So there's the deductible stage. A lot of plans will have a deductible that you have to meet on some or all of the prescriptions before you get to the initial stage. So you satisfy the deductible, and then you go to the initial stage where you're basically paying a co-payment, like you do right now. You go to the pharmacy, co-payment, everything's good. And that's where it stops for most people. Per the Affordable Care Act, every month you're sent a statement which effectively says this is how much you've paid so far, you know, deductibles, co-payments. This is how much the drug plan has paid. This is the cost of your medicine to date. If the cost of your medicine, not what you've paid, if the cost of your medicine, $820 during the calendar year per Medicare, you are now in the gap, the coverage gap stage, sometimes referred to as the donut hole. And now the co-payments are going to stop. Next time you go back to the pharmacy, per Medicare, you're paying a percentage. So you're still covered. Don't ever, you know, it used to be a case whereby you went into the gap and you had to pay 100% yourself. But now, you're paying a percentage. So if we go into the gap and we go back to the pharmacy to get a prescription filled in the coverage gap stage, now you're paying 37% of the cost of a generic, 25% of the cost of a brand name prescription. So you're still covered, now you're paying a percentage. All right? The gap finishes. Again, most people go nowhere near this gap. The gap finishes when you, out of your pocket, during the same calendar year, have paid $5,100 out of your pocket in the same calendar year. Then you end up with the catastrophic coverage where you're effectively paying pennies on the dollar for the remainder of the year. Who wants an example? No, don't put your hand up, whatever you do. I'm going to give you one anyway. All right, let's say you had a $50 prescription and you went to the pharmacy and they said, $10 co-payment, please. And you give them $10 and you leave with a $50 prescription. You get the statement at the end of the month. You have paid $10. We've paid $40. Cost of medicine, $50. So we bring that over here. Cost of medicine, $50. Is taken from the $3,820. $3,770 left to go. Okay. What you paid out of your pocket, $10, is taken from the $5,100. $5,090 left to go. That's how it works. Don't argue. Don't disagree. There's no point. That's how it goes. That's how it goes. And if anyone says, that's a bit of a worry, there's programs out there. There's programs out there that we can talk about. Any questions on Part D?
You did say that the co-pays, the initial co-pays are part of the $5,100.
Anything you pay out of your pocket, whether it be a deductible, a co-pay, or a percentage, anything you pay out of your pocket for a covered Medicare service, a covered Part D prescription, sorry. Yeah. I mean, if it's not covered, you're paying for it yourself, then all bets are off. I ain't going against any of this. Yeah. This does carry over from plan to plan. Yes. Now, any other questions? I'm going to put this to bed. All right. So just recapping. Supplements. You've got to have A and B, you keep it. Medicare's primary. We'll look at Medicare for rules and decisions. Medicare pays most of the bill. Supplements pay balances for covered Medicare services. If we want Part D, we get any one of those 26 in there. You can get whichever one. It doesn't have to be from the same company. Just get what you like. Now, enrollment in a supplement, as long as you've got Medicare A and B, you can enroll in a supplement any time of the year. I will try out the joys of Medicare by itself. And then, a few months' time, you can go get Medicare A and B. All right? Medicare Advantage plans, that Part C. So again, you've still got Medicare. All Medicare is doing is paying the Advantage plan. As a result, the Advantage plan is going to cover all of the services that we have with Medicare and a heck of a lot less money out of your pocket, and it's going to bring a lot more of your routine services that you might be used to right now. But now we've got networks. Again, here's we're turning 65. There's that 7-month window around our 65th birthday. We're going to go work past the age of 65. There we are, 3 months before. We can enroll up to 3 months before we're going to retire. Remember, it's always the first of the month. All right? There are exceptions to this turning 65 and or working past 65. If I'm on an Advantage plan and I move from one area to another, I might be able to change the Advantage plan at that point. If I have Medicaid or I'm losing it, I can make a change. If anyone is concerned about this donut hole, this gap, says, I think it might apply to me. I'm very nervous. The state of Massachusetts has a program called Prescription Advantage. And by getting that also helps you make a change during the year. It's where a little smidgen of the cigarette tax goes these days. And then if you're enrolling, Medicare ranks all of these Advantage plans right across the country out of 5 stars based on quality and care and what have you. And if you're looking at a 5-star plan, you can enroll in one of those plans any month of the year. But then we go to the far right. This is what most of you have seen on the television, whereby at the end of every year, per Medicare, Medicare says everyone with Medicare A and B has from October the 15th to December the 7th to make a change. Again, this is individual, this is not a group version. So everyone has from October the 15th to December the 7th to make a change, and the change is effective the 1st of the year. So if I'm going from Advantage to Supplement, from the high-end Advantage to the more affordable Advantage, if I'm going from one company to another, that's when I do it. The change is effective January the 1st. Additional resources. We're near the end. We're very close to the end. Oh, I wanted more slides. No, I know. So at the top, you've got Medicare and Social Security. Has anyone ever heard of a Shine Counselor? Well, you now can say that you have. Shine Counselors are volunteers that work out of your local senior centres. They don't cost anything. They go in there maybe once or twice a week, and you can make an appointment and sit down with them. And if you're confused, and if you've got all this information, you don't know what it means, and you're trying to find out what the best drug plan is, etc., you can sit down with them, and they will explain, you know, what all the options are. All right? And again, a good place to start off is going back to your doctor's office, finding out what plans they take. Prescription Advantage, there's that prescription drug plan. Now, Prescription Advantage, again, from the state of Massachusetts. So if you think you're going to go into the gap with prescriptions, or if you're just a little bit nervous, you can apply for Prescription Advantage any month of the year. And Prescription Advantage is going to sit there and supplement whatever existing Part D plan you have. Doesn't matter if it's one of those 26 in there or it's part of an Advantage plan. The gap is the gap, and if you think you're going to go in it or you're just a bit cautious, you go out and get Prescription Advantage. And if you go into the gap, you show the Prescription Advantage card and it effectively removes the gap. Prescription Advantage is based on your income. They do a 1-year look back, but the limits are quite high. So don't anyone go, oh, it won't apply to me. It's quite high. All right? And then there's me. All right? You can call me at any time. Questions?
Yes, I take eye drops. Is that a drug?
Oh, it's a drug. Even though your eyes are getting it and not your mouth. Yeah, it's a drug. And a lot of them are quite expensive.
What's that?
A lot of them are quite expensive.
Mine is.
Yeah.
Doctor, no?
Oh, no. But you just see some of them in a little bottle, but big price. Any other questions?
I have a general question. My wife works in the state, so who's going to get one of these supplement plans? If she, for instance, joined the supplement plan, would it be possible for me to do the Advantage, or do I have to do what she does?
The state usually wants you to go company for company. So if you go Tufts, then you've got to go Tufts as well. Generally, the GIC is a little bit specific, and you've got to follow. I know you've got to follow their directions, which you've got to because.
In other words, I would do the same plan.
Yes, you would. But and so what it'll do, obviously, so everything when we get Medicare, I should have said this at the beginning. Everything when you get Medicare is individual. No more family, no more two-person. You might have the same policy, but you've got your own policy with your own identification number. You've got your own with your own identification number. Everything's individual now. So therefore, for the people that don't have retiree coverage, that are couples, you're not having to do the same thing. Oh, I want the zero premium. I want the supplement. Fine. No one's, you don't have to make a compromise. You get what you need. Everything's individual. One isn't making a compromise for the other.
We could each have a separate plan under, let's say, Tufts.
Yeah. But yes, if you went with Tufts, yes.
Yeah, I know.
Yeah, no, yeah, but I mean, you've got that exchange that you've got to look at to see.
Oh, right.
Yeah. Yeah.
If we go.
Yeah, if you yeah, and just because you work past the age of 65, no one says you have to have your company insurance. I mean, the idea is that you've got to have insurance. That's the Affordable Care Act. You've got to have insurance, but sometimes you'll find with smaller companies they'll have a higher deductible and they'll put the premiums up. No one says just because you're working you've got to have company insurance. So if you're not too happy, if you're working and you're not too happy with your company insurance, there's nothing to stop you getting a bit of paper, putting a line down the middle. Company insurance, premium, co-pays, blah, blah, blah. And then on the right-hand side, doing a comparison with Medicare, $135 a month, plus do the comparison. No one says that you've got to have group insurance, and ultimately, if you have group insurance and even if you're still working and you want to leave it, you can do so any month of the year. You're not locked in to the anniversary. You can leave any month of the year, and Medicare calls it a special election period, voluntary group disenrollment. Keep working, but if you find it's cheaper or better to go by yourself with Medicare and something else, you can. I'm just putting that out there just in case, all right? All right, I'm going to start drinking. Cheers. Was this helpful?
And more confusing in some ways.
You want to be me? You want to be me? Yeah. All right, so take the information. If you have any questions, feel free to call me. Again, this is not about Tufts tonight. I have meetings up at the Radisson if you're more than welcome. But if you want to call me at some point, if you have questions, if you want to check the status of your Medicare, if you want some information, that's another time. You can email me, text me. The best number to reach me at is my cell. I am local, hence the accent. I live in Billerica. So I am local.
So when is the next meeting at Radisson?
I don't know. It's going to be later this month. It's going to be. I don't have the immediate details on me. Yeah, I'm not. It's again. I'm not. That's not the purpose of this.
No, I know.
Yeah, but a call to me and we'll tell you.
I have a feeling the other company with that deal, they probably have higher rates or something.
Well, what you do if you want to, give me a phone call.